The three-day national high-level dialogue on domestic resource mobilization for sustainable health financing toward UHC came to a close Wednesday amid calls for improved health financing. Stakeholders urged the government to ensure the prudent use of funds for better health services.
Countries need to consider whether the way in which revenue for health services are raised is fair and progressive to ensure equity as one of the main goals of UHC. Kenya needs to ensure that it spends public money as effectively as possible.
In the last period, implementation period of the Global Fund, I think that concluded in April or June 2021, Kenya did not fully absorb all the money that was available from the Global Fund. I think while we seek increased funding, let us ensure that we fully utilize both the national and donor funding effectively.
The Council of Governors called for more funding to counties as per their mandate to provide health services.
The counties have a budget of 2.9 billion. So it is time we had better synergy and equity to ensure that where rubber meets the road in the counties, we get the support for more funding to ensure healthcare is delivered to our citizens and we achieve UHC.
At the same time, the government committed to increase domestic investment progressively through tax revenues, social health insurance revenues, and strengthening private investment, among others.
The government of Kenya will progressively increase the total government expenditure on health as a proportion of GDP to 5% and progressively increase the allocation of the national budget of health to 15% and 35% at county level by 2030.
Indeed, without a robust healthcare financing mechanism, then this whole desire to achieve universal health coverage becomes only but a mirage.
The government will also engage the private sector to strengthen public health systems and expand access to health services. Nancy Okware, Prime Edition.